right. Afternoon, guys.
Friday afternoon.
Friday
Did
afternoon. Todd Otten.
We made it.
We made it. Yeah. Todd Otten, welcome.
Thank you. Thanks for having me, guys.
It's
Yeah,
good
man.
to see you again, man.
Yeah,
You,
likewise. It's becoming
you're-
more frequent here, Tom, which is, I think, a good
Yeah.
thing.
Yeah, we're trying to get something going. We'll get into that too.
Yeah, we're going to get into that for sure. But you're the only guest that I can think of that we've had in a while that's got as many letters after their name as Tom. So I'm excited. I'm also excited to compare.
Yeah,
to...
all his letters trump all of mine, though. That's the problem.
Yeah.
I don't know about that. So I got a funny story, if I may, regarding letters after the name. So I just did an interview.
I might have told you this is a podcast. We talk about stuff here.
Yeah.
This is a long form conversation, sir.
There was a memo somewhere, for sure.
Yeah.
So I interviewed a ER physician, Terrence Mulligan, brilliant guy. He's set up ER systems around the globe, dozens of them. But he has, I don't even know how many degrees he has, like 6 or 7. And so for my icebreaker question for the interview, I said, so Terry, I want to know how many letters are after your name, and I want a number.
Yeah.
Give me one number. And he's like, I don't know that I can actually give you that. And
Yeah.
I was like, that's a lot of letters.
Yeah.
It was like 20-something.
Oh,
Wow.
Jesus. Yeah. You're basically at that point, you're like, you could just call me Bob. It's fine. Just don't,
Yeah, I've got
like,
nothing to prove.
Yeah, I've got.
Well, he's sort of, as a lot of physicians do, and a lot of professionals do, like, you think you don't have enough information, so you're like, well, I'm going to go get another degree. Or
Sure.
I'm going to get this fellowship or whatever. And it's for some, it's a never-ending quest of addition of letters, I suppose.
And you know what's funny? Somebody asked me, more than one somebody at this point has asked me, they're like, now that your show has gotten to where it is, like, do you envision yourself going to get like some kind of degree that would kind of give legitimacy? I'm like, what the hell would I ever need that for? I get to talk to like people from all different types of stuff and get to learn exactly what I want to learn and nothing else. Like,
There's no gatekeeping and like, bio 101 you got to sit through to get to what you want to do. Yeah.
It's interesting since we're talking letters. So, obviously going through medical school, that one's near and dear to my heart and very important to me. But for a long time, I'm quite certain I met the criteria to be a fellow of the American Academy of Family Physicians. But I just saw it as more paperwork to do. And so I never went after it. Until recently, I'm getting in these circles where, in certain cohorts, that adds a little bit of gravitas, I suppose. I'm like, I guess I probably should check all these boxes and fill out all the paperwork and so on and so forth. So that's essentially what that amounted to.
And it's funny, I'm not in academia at all, but we talk to a lot of academics, obviously, and it's like it's really hard for me to sympathize with that, because in my world it's kind of a show and tell. Like, you're as good as whatever you're showing, and like there isn't any other verification necessary. I mean, my son's going to college next year and he's taking SATs and everything, and my daughter just started high school at an arts college, and they're like, you want to take all these AP classes? I'm like, honey, no one gives a shit about AP chemistry. You're going for visual arts. You're going to drag a portfolio 18 by 24 to whoever wants to vet you. And that's it. Like, full stop. Like, you don't need an SAT score, and the people at the school are like, yeah, that's pretty much accurate. And so, like, for me to be like, oh, I need these letters to be validated, is like, well, couldn't you just show them that you know what you're talking about? Like, is there a way you could do that?
I feel like there is a certain threshold in I think I told this story on the air. I had my 85-year-old cousins going, well, med school is free now. And I'm like, I've been doing this for 25 years. And they're like, you could be an MD. And I'm like, I am not sleeping on a cot in a closet in a hospital at 50. Like, just not happening.
Tom, I was probably going to start to just talk you out of that right now.
Like, So the new focus of the show,
be free, but it is not free.
There's a cost to everything. I lost my hair a long time ago. That's all I'm saying.
So you're saying I can go to med school for free if I wanted to indulge in such torture?
Hopkins, Einstein School of Medicine. There's like a handful that are actually giving you free tuition.
Yeah, it's interesting we're talking about this. We interviewed Mark Cuban for the documentary, and that was actually one of the things that he brought up as a potential solution to many of the problems that exist.
Mhm.
What cost barrier?
Say again?
Cost barrier? Is that what he?
Cost barrier was one of them, but then also the quote unquote golden handcuffs.
Hmm.
A lot of my colleagues feel inhibited from speaking up or advocating in the current climate because of their debt load.
Yeah.
Like if they get fired and all of a sudden they lose their income, they're screwed.
Sure.
And that's an issue in and of itself. But also the barrier too. I mean, with some of the recent, I don't want to get into politics too much because I'm not a political expert, but some of the legislation that's gone through, I believe, has put some caps on loans.
Yeah.
Which limits a whole subset of people getting into medical school.
Which was intentional. But okay, let's not get. We said we weren't going down this whole time.
Yeah, I'll I was like, as soon as the words are coming out of my mouth, I'm like,
seems like they just won't stop.
We're gonna be singing Bella Ciao at the end of this motherfucker. But yeah, there's so many hurdles. I know a brilliant gynecologist, and I met her at this now chain of wellness centers that we were setting up. And she rolls in, and she's been in the field for 15 years or so. Her husband's an ER surgeon. I go, that's big bucks coming into that household. And I pull in, and I see her pulling in with a Dodge Caravan with duct tape on. And I go, you're one of the smartest people I know. How the fuck are you driving that car? And she goes, me and my husband owe almost $750,000 in student loan debt, and I got 3 kids in private school. And I went, oh,
there's that.
There that is.
Yeah, totally. I mean, as you're telling the story, numbers are ratcheting up in my head going, man, they got to be up close to $1 million.
Yeah.
In terms of debt, when you factor in undergrad and medical school and all those other things.
Yeah.
Fortunately for me, I was blessed not to be shackled with that debt for a couple reasons. I mean, undergrad was part scholarship and part hard work.
Yeah.
Being a paper boy from age 12 to 18, despite being bit by 5 dogs, I persevered. But then, with the medical school being in the Navy, that covers that.
Yeah.
And I think for me, the beauty of that is it freed me. When things weren't going well, I wasn't afraid to speak up, and that has just clearly accelerated in the last couple of years.
Sure.
And, the latter half of my career.
You mean not everybody's making documentaries on medical burnout as doctors?
I mean,
I think they're too tired.
Yeah.
they might be, but not that I'm aware of. No,
Yeah.
I mean, I think, I guess if you want, I can backtrack and sort of fill you in.
Yeah, man,
do it.
Please do.
So I'll give the standard disclaimer. Tom, you've heard me give this spiel a little bit, so
yeah,
I don't make your eyes glaze over. But I'm not going to read my CV, but I think there's some key points in sort of career 1.0 and now career 2.0. So why is a family physician doing this? Like, how did I get to this point? What's driving me? Finished 02, thought I wanted to be a trauma surgeon, realized the training itself was traumatic.
Yeah.
Honestly, and somewhat sadistic. I'm like, this is insane. This isn't what I signed up for. Fortunately, I was in the U.S. Navy, as I mentioned, and trained as a flight surgeon. A total misnomer. It's really primary care for the pilots, the air crew, etc. I loved it. It was incredible. So that allowed that there was a pivot there. When I paid back my time in the service, I went back to Michigan, did my residency, joined a critical access hospital, and most of it was incredible. I mean, I love seeing patients, like most physicians. Like there's a and you guys can attest to this. There's a joy to helping others that, that dopamine hit, that euphoria of helping another human being is amazing. And depending on what you're doing, it could be these repetitive hits, if you will, of dopamine in a good way, right? Unfortunately, 2019, I went through horrendous burnout. Like, if you took a page out of a book on burnout, like, I probably was filling all the criteria. I mean, at one point, I was a angry little man at just about everything under the sun. And that's a hard place to be. When you're historically loved your job, to be going home and crying in the backyard and ready to quit, it's a terrible feeling. and you're supposed to be helping other human beings and being at your best while this is going on. It's twisted, and it just creates all kinds of issues. There came a boiling point when I had some pay withheld because I had a couple charts that were incomplete. I mean, literally 2 charts were incomplete. 2 boxes needed to be checked, 1 in each chart. I couldn't do it. The medical assistant had to check the boxes. I'm like, this is insane. This is not what I'm here for. This is not what we're supposed to be doing. I was ready to just quit. I was so pissed off. My CEO gave me some time off, and I came back, and it was probably 2 years to recover from that, to be quite honest with you. That's when I wrote the book Ripple of Change. And that was really the start of some catharsis for me. And I would say that process is still ongoing, to be honest with you. But there's another pivotal moment, August 2nd, 2022. CEO and a VP were like, hey, we got a great idea. We can save money on rent. We're going to move you back to the town you got burned out. So let me get this straight. You're going to re-traumatize me on a daily basis so you can save money on rent. Did you think about the possibility if I just quit? Like what all the negative ramifications are going to be from that? I don't think they really did, because I had been very transparent about like my trajectory, and I was happy and didn't want to move and all these other things. So I go into this meeting literally with a coffee cup, Matt and Tom, that says, be careful or you will end up in my novel. And I set it down in front of me, and the VP's like, is that a warning? And I'm like, well, I guess
it's just a coffee cup.
Depends on how this goes. Sure enough, went home, told my wife, she started crying. I resigned the next morning. And even then, I don't think they believed me. So fast forward through that process of lunacy, I would say, from an administrative perspective, like not acknowledging my resignation for a week because they thought I was bluffing and all this other crap. It really propelled me into Career 2.0 and networking and advocacy and getting connected with amazing people like MZ, Matthew Zachary. I mean, he was kind of the first big podcast I was on. You know, here I am, just published this book, trying to figure out like, oh, what the hell am I doing in the world now? And flying out to New York for like 22 hours so I could be on a show and all these things. Meeting Marianne Wilbur. And now, I mean, with what we're trying to do with Suck It Up Buttercup, I mean, we're aiming to really make a big push towards positive change, is probably an overly simplistic way of describing it. Hopefully that wasn't too long. I'm trying to give you sort of the highlights and how I got here. So here we are.
So that's like, how typical is that story? I don't know. I'm actually asking, like, I mean, you know, like you wrote a book about this, you're writing a movie about it. So obviously it's typical enough where it resonates with enough people that you felt compelled to do all that. But like, is this like a really typical situation where people are like, don't believe you, don't take you seriously, and they just expect that because of that handcuff thing, maybe they just keep on keeping on?
I think there's parts of this, Matt, that are really common, to be honest with you. I mean, in particular, like burnout, and I'll speak from, you know, a physician, so you tend to talk about your circles, but this could be extrapolated to so many other places in healthcare and really beyond, if you think about it. Burnout is pervasive, and there's a lot of reasons for that. I mean, the current statistics, you got about a 50-50 shot that when you go to see your physician, they're burned out. Depressed, lack of empathy, frustrated, angry.
Yeah, right.
Pick one of the things, like, really? That's where we're at right now? So that part of it's really common. The whole telling your employer to shove it component to it, I think, is becoming more common. The authorship by physicians is shockingly robust. There are a lot of books written by physicians, and a lot of really good books, some fiction ones, some nonfiction ones, a whole host of things. Making a documentary about it, that we're probably starting to really narrow the...
now we're getting down the rabbit.
You're going to get a smaller sample size there.
So, well, I mean, I have one of my good friends is a documentarian, and you know, she does amazing work, but that shit is hard work, man. I mean, it's between the fundraising and the scheduling and the actual producing and like getting sources and like interviewing. I mean, it's, you know, it's probably easier for Michael Bay to make Transformers or something like that, like, because it's like there's none of those things to worry about, like, but then it is to make a documentary with, you know, about anything like real.
I couldn't agree with you more. I mean, it's one of these things where let's make a documentary. Oh, this sounds great. And you jump right in and you're like, this is going to be amazing. And then as you get going, you're like, oh my God,
a lot of work.
This is exactly what you said.
When you're smoking a joint at 2 a.m. on a Friday, you're like, we should make a documentary. This sounds like a great idea. Monday morning, you're like, what the fuck was I thinking?
Wait, there was a contract? I signed a contract?
Shit, what's happening? Yeah.
Without a doubt, there has been moments of, over the whole spectrum of this. But I think, at least with this project, I think one of the things that's very much in our favor is the topic hits pretty much everybody,
right?
In terms of healthcare delivery and the frustrations that people are having related to it. It's kind of universal, which there's some benefit to that, I would say, in terms of getting guests and raising money and all these other things. I think that's helped a lot. One of the other interesting parts of this is, and I think it speaks to what we're trying to accomplish, literally when a door closes, like a much bigger one just comes swinging open, and I'm like, oh my God, how did that just happen? What did we do?
Yeah.
How did we get here? And I'll give you an example. So Don Berwick, for those that don't know, Don Berwick has been doing work in the healthcare space and healthcare reform for 30 plus years. He was the head of CMS for a time in the Obama administration, one of the original leaders of IHI, Institute for Healthcare Improvement, one of the founders of the Triple Aim, so all these just amazing things. He wrote a kind of a landmark article called Salve Lucrum, which is Latin for Hail Prophet, which obviously landed with many people regarding healthcare reform. And so where I'm going with this is, so a couple dominoes hit. Next thing you know, we're at Don's house in his backyard interviewing him. And I am like, I was transported, as I say, to nerd heaven.
Yeah.
I was so excited by the end of it. I had him sign my laptop because I forgot to bring something to have him sign.
Yeah, you're signing something, dude. I don't know what it is, but here.
He just got the biggest grin on his face. But it's like, I'm sitting there going, how did we get here? How did this happen? Interviewing people like Mark Cuban and Dyke Drummond and Wendell Potter, and the list goes on and on and on of amazing individuals who are really striving towards the same thing. And I think it speaks to just the level of frustration in this country with healthcare delivery.
I couldn't have imagined any other explanation for that other than I think people don't even understand necessarily what the grievance is until somebody else says, hey, I'm making a movie about this. And you're like, oh shit, I'm also pretty pissed off about that, or pretty passionate about that, or pretty, I got some words on this, but I don't know how to articulate this, but when something's bad and it's been bad for a long time and everyone just accepts it, it's not really bad. It just is, right? And then when somebody goes oh, wait a minute, hold on a second, this kind of sucks. Then you can put words to it, and then people can decide for themselves. Oh yeah, I think I want to get behind this. But
yeah,
to your point, it speaks to everybody.
I also think, Matt, a lot of that comes from the idea that we're still holding on to this idea that, the smart ones, the better educated ones are going to be doctors, they're going to be bankers, they're going to be lawyers, they're going to do great things. And then a bunch of people are putting on a lab coat and realizing, no, not only is the money going to somewhere else, I'm just a cog in a wheel that'll get replaced if I burn out. There's no compassion for the healthcare worker either.
Oh man, there's so much we could dive into on that. I think the first one I'd like to maybe come back to a little bit is what Matt said. That comment about, well, this is just how it is and we're accepting of it. And you hit the nail on the head with, this is a big part of the problem.
Yeah.
For a whole host of reasons. I talk about learned helplessness. That you're the dog in the cage who gets shocked and shocked and shocked and shocked and shocked. And finally you're like, well, heck, it doesn't matter what I do. I'm going to get shocked. So even when they open the door, you just lay there and get shocked.
Yeah.
That's learned helplessness. And that's from a study, his name escaped me, it doesn't matter, but from the 60s. And that's one of the calls to action of the documentary, Suck It Up, Buttercup, is to unlearn learned helplessness.
Right.
The fact that these conversations matter. Your voice matters. Your vote matters. All these things will if the 300 million plus people did something to move the needle in healthcare, it's going to be hard to ignore. So yeah,
and it is the most funny thing to think about too, right? Like your health, when health fails you and you're in a situation where you need fixing, the very last person I want is somebody who's super pissed off, angry, sleep deprived, malnourished, whatever the fucking problem is. It's all of those things. I've seen all of those things. And like, it's like runs counter. Like, no, I want the dude who's razor fucking sharp. It's like super happy, beaming ear to ear, ready to help. Like that's who I want helping me. I don't.
Man, are you suggesting that you might get a better outcome then?
Right.
That's heresy, I believe.
Yeah, it's heresy, right? And then but it's built into the system, right? Like those hours for residents doing rounds, and you're doing 12 hours.
Intellectual hazing is what I've always called it. Like they're just going to beat the shit out of you and keep you run down to
which
see
is fine
how much.
If you're pledging a fraternity.
Well, it's fine if they're trying to see if you can make it into the SEALs,
right.
But yeah, you're absolutely right, and that's part of what was my whole thing. Yeah, I'm not sleeping on a cot during a 12-hour shift at a hospital at any age, let alone as I'm middle-aged.
Well, I mean, there's definitely intergenerational trauma that's been embedded into medical training, and I don't want to get into weeds too much, but I recently wrote about William Stewart Halstead, who is a surgeon who was involved in creating surgical residencies, and he happened to be addicted to cocaine and tried to get off his cocaine addiction by using, I think it was either heroin or morphine. I think it might have been morphine.
That's my go-to.
Yeah, well, hey,
why you got an upper, you need a downer.
Why not model your training program after this individual? It's like, no wonder why it's so effed up.
Yeah. This is where it started with this fucking lunatic. Like, so of course nothing that comes after him.
Like, hey, it's a badge of honor to be, not sleep and all these other things. So it's fascinating, and we're gonna definitely highlight components of that, like the historical arc of healthcare and how it's gotten to this point, particularly under the auspices of greed, and how greed has really, I mean, in many instances, destroyed our healthcare delivery system. I mean, there are deserts of care out there, which is sad because people get hurt.
Yeah. And you're hearing more and more about hospitals in small towns closing.
Yep.
Yeah. And that, I mean, you talk about a food desert, which isn't any better, right? But when you start talking about medical deserts, like, all right, well, you need to eat, but you really need medical care, especially if you can't eat, right? Like it's sort of like a self-fulfilling.
Well, think about if you're pregnant, right? And you're in an obstetrical desert and you have a complication. Not only
what are you going to do?
You're losing 2 lives there. Yeah.
You're losing 2, and this is because OB units are closing all over the place. It's a wonder we've got really crappy, maternal and infant mortality rates when compared to other developed nations. I'm not an obstetrician. I'm also not a statistician, but let's just say we're not doing well, and I'll leave it at that. And it's embarrassing. I mean, we spend $5 trillion a year nearly on healthcare in the U.S. The per capita spending is way past any other developed nation, and yet we have some of the worst outcomes. It's like a bit of a disconnect. You know what I mean? Like, I don't know. It's frustrating, but I don't want to be Debbie Downer either. I mean, there's a lot of amazing people out there. And I think that's at least one of the things that we're trying to impart, and I tried to impart with writing a book, and now this project is to inspire people that get on board, come with us. Let's not this shirt's not okay.
Yeah, right. But you know what? You just said it, and it's like, I don't know if it's because your Gen X is showing through, or we're all sort of like programmed for this, but you almost back out of what you were saying. You're like, oh, I don't want to shit on them, I don't want to keep saying all the bad stuff. I'm like, yeah, but the thing is like, we've been not saying stuff about the bad stuff for long enough. Fucking it's time to just tell everyone to shut the fuck up, and now let's talk about the bad stuff, right? Like the bad stuff needs to be aired out, obviously, or else I wouldn't have had to make this fucking movie.
Isn't helping.
Yeah. Right.
No, sorry, Tom. I didn't mean to jump in on you there.
No, you're fine, man. I was saying nothing important.
Yeah.
That's awesome. Well, no, Matt, I think you're right. But one of the things that I think I want to be conscious of, right, is I don't want to be out there just talking about problems. part of the goal, my goal, is to talk about solutions.
Mm-hmm.
And, I alluded to the one solution in terms of unlearning learned helplessness. That's obviously an internal or personal choice to go down that path. And we're trying to inspire people to do that. The bigger call to action with the documentary is really around the notion of an impact. There's all these incredible people out there doing amazing things, but literally at times what I've noticed is like they can't get on the same page because the comma in the mission statement is one character to the left. And I'm like, this is part of the fucking problem.
Yes.
We've got these institutions who are supposedly advocating for X, Y, and Z and are so concerned about rocking the boat that what changes? What status quo are you actually challenging? Are you challenging the status quo, or are you really perpetuating it? And I'm not going to sit here and start naming organizations because I think that would defeat the purpose. But if you talk to my colleagues, there are reasons certain percentage of physicians are under certain organizations and not. And that in and of itself is telling. It's telling.
And the other thing that I see here is sort of the danger that we see everywhere else of people taking like an all or nothing approach. Like, you hear something like this and you're like, okay, like you were just backing off of it a little bit. Like it's not all broken, but then people start getting into these little niche rabbit holes. They're like, well, but if we didn't do that, it must be like this. And like people are stuck with these unpacked assumptions about like, because we've all been fed the same bullshit, right? Doctors need to sleep on a cot during residency because that's just makes a better doctor. And no one ever thought to be like, well, really? Does it? I don't know that that's really a right thing. And, we're seeing this sort of, I don't want to call it awakening because then I sound like some woo-woo person, but like you're seeing this sort of unembarrassed, unencumbered questioning that's coming out of people now asking questions like this all across the board, right? Like we have psychedelics are booming right now. We've got all this other stuff happening that never would have happened a few years ago. It's like we're waking up.
I think there's legitimacy to asking questions and being curious about things, especially when they're not working. I've been doing a lot of reading on trauma and so on and so forth, and having been an expert at compartmentalizing stuff for the better part of 4 decades and never processing any of it.
Sure.
I can tell you firsthand that is a shitty way to do things,
sure.
Like big time. And when the box gets opened, it becomes a mess very, very quickly. And one of the things I learned with trauma, and I think this can be extrapolated to other things, is you've got to embrace it. You've got to hold that discomfort close to you, be curious about it, explore it, ask questions, and ultimately that leads to healing. And I think those principles can be extrapolated to many different things, including how we fix healthcare. I mean, having a Rube Goldberg project as a healthcare system is not ideal. I'm taking that from Terry Mulligan. He talked about it being put together with like duct tape and chewing gum and all these other things.
I mean,
and he's not wrong. For years, we've basically been putting our fingers in different parts of the dam to kind of keep it going. And we're on the verge where, the whole dam is holes with people just holding their fingers in it, right? And that is only going to work for so long. We're right there. And in some places, it's already happened. Where hospitals are getting shut down or there's no care. So we have to lean into those issues and then ask questions. And ideally, that'll help us with the way forward. Because it is complex. Like, don't get me wrong, healthcare delivery is incredibly complicated. It's a social science for a reason.
Right. Well, and it's also, just in deference to how we get to these situations, right? I own a technology company for a long time, and technology is a non-human critical version of the same problem, right? You start out, you build a piece of code and it works. Then somebody comes along and says, well, I'd really like it to do this other thing. And then somebody who didn't build the first one looks at it, makes a guess at how their little bolt-on should fit into the piece, and then they snap it on. And the first couple go fine, but then fast forward years and years and years later, you've got 600 Legos put onto this piece and no one remembers the first person who did it. Like no one understands like how it was made, and the system falls apart every day. And you're like, and so we spend tons of time going through and be like, what's broken? What's broken? Then you go back and you're like, what idiot put this here? And it was like 65 iterations ago. And it would have made total sense if the story ended there, but it didn't. So it's like, this is just a human condition thing, I feel like, right? We just, instead of evolving better systems, we just add to the ones that are already there, right? Like we're not asking, well, should we just tear this one down and start over? Because it kind of makes more sense. Right.
Yeah, 100%. Well, and I think, I mean, goodness gracious, in many instances, that's where we're at with, at least with healthcare living in the U.S. is like, do we keep putting more duct tape and bubble gum and rubber bands and paper clips and whatever else you want to talk about to try and keep this going? Or do we go, okay, forget this. Like, let's get the basics and go from there. And you're seeing it in certain circles, if you will. I don't know how familiar this
Our family health insurance is almost as much as my mortgage. In fact, I think it's a little bit higher.
It's insane, and like
it's crazy.
And what are you getting for that? You're getting the privilege of...
I'm getting $3,000 deductibles, so nothing's even covered. Like so it's like basically, I had to have an MRI. My son had to have an MRI, and my son had an X-ray all this year, right? So active year by medical insurance standpoint. We haven't had a single benefit from insurance yet because we had a super high deductible because we don't really ever go to the doctor. And the only way to make it not be a mortgage payment is to be like, all right, fine, I'll take the $3,000 deductible or whatever. But I'm like, why are we paying anything? Like, this is not helping me. Like,
Totally. Two things I was going to add to that. One, so back to when we were interviewing Cuban, he was talking about, so how does that work for the person that has $400 in the bank and $2,000 deductible?
No, exactly.
He added some colorful language in it. Well, it doesn't, right? And so that's why we're seeing things like DPC or direct primary care, where you've got the clinician, physician, APP, whatever, and the patient, and you just cut out the vast majority of that fat, and it brings the cost way down. And not only that, you have more time with your clinician. And you get better outcomes. Like, duh.
I went concierge a few years for that exact reason. I'm like, I'm sick of this. I can't deal with this.
Yeah, and you're going to see more and more and more of this, and you're seeing it with surgical care, direct specialty care, free markets, people paying cash, all these things. And I think we're going to continue to see that because people are fed up, like paying huge premiums and not getting anything for it. I mean, when I was in between and I had taken time off from my previous employment and we're paying the COBRA or whatever, I was getting pissed. I'm like, we're paying like $1,700 a month for our family, healthy, no issues really going on. And after a while, I'm like, told my wife, I'm like, what are we paying for? Like, if anybody knows how to navigate the healthcare system and get through it, I think I'm somewhat qualified to do it. Like, I don't know that we really need to talk to this point. I mean, I think I could manage for a while. And finally we just got rid of it, and went without insurance for a little bit. There's calculated risks that if something catastrophic happen, but outside of that, I mean, I didn't miss much otherwise.
No.
Right. Yeah. And don't get me started on dental insurance. Like, I think that's just a myth. It's just like,
you give us $200 a month, we will cover one cleaning.
Yeah. Which costs $75. You're like, okay, great. Like, I don't know. Yeah, no, I mean, and it's funny because we got a lot of connections down to Costa Rica, and like they have a socialized medicine down there, but it's, you'd wait weeks or months or whatever. So anybody who's not broke, that's the only thing they do. They just walk in, like it's normal for them, and they don't have a lot of these problems because they just can walk in and be like, here's $500. I need an MRI and 3 X-rays. And it's like, let's make a deal. But they have none of this like overhead. And I'm like, okay, so I don't know if we want this system, because it is a little bit like, I don't know. It is literally a let's make a deal kind of thing. And I'm like, that feels a little off for my healthcare, but like, I don't know. It's a business as well. I guess there's an argument to be made for that, but like, I don't necessarily think we got to go all the way that way, but certainly there's got to be somewhere in the middle we can land here that's a little bit more rational.
Well, and I think, back to, the whole purpose of what we're, the Suck It Up Buttercup in the documentary is to lean into some of this stuff, explore. I mean, there's a boatload of smart people out there working on these problems around the world, and who knows where the solution's going to come from. But if we're all doing it in our own little silo, we might be missing the boat from across the globe that got the answer for us, right?
Right.
And I think that's where we've got to continue to explore and lean into this discomfort to ultimately come up with a better solution. Like, I'm not sitting here saying, like, Matt, Tom, and Todd, we got it all figured out. By the end of this show, we're going to have the answer for how we deliver healthcare in the
you don't
United
even
States.
need to release the documentary. We got the answer right
Yeah,
here.
We got it. We're done. No, but I always found it.
It'll be at the last 2 minutes. The answers will be
The answers will come.
That'll keep people around till the end.
Yeah.
I always found it funny that we can't just look at countries that are doing it better and say, what are they doing right? What are they doing wrong? And make those shifts. It didn't make any sense to me.
It's not America, therefore they're dumb.
Yeah,
right?
I totally get that. And they will say things like, well, that's not how we're set up. And then you start looking at the definition of insanity is doing the same thing over and over again and expecting different results. And to your Lego analogy, yes, as we learn more, as we add more specialties, as we find new techniques, we're just fucking sticking it on to a frail system.
Yeah.
Anyway.
I mean, no, I think you're spot on. Perfect example. I'm sitting in, Natick, Massachusetts right now. And a few months back, we went to a remote area medical mission. I don't know if you're familiar with that organization at all.
No.
But was that a nomad? Sorry.
Yeah,
no. Is it like Doctors Without Borders?
There's some similarities there, I would say. But you could probably describe it like Doctors with a Border, like the United States being the border.
Oh, gotcha. Okay. Doctors with a big border.
Yeah, big border. Hundreds of volunteers on a given weekend get together to deliver free medical, dental, and eye care to hundreds, if not thousands of people, whoever shows up. This has been going on for over 40 years in the United States.
And I've never heard of it, and we run a health podcast.
Heard of it.
And they're helping. I mean, the number of people that have been helped through this organization is through the roof. But I think it speaks to like the complete disconnect at times that exists with what we think we have in terms of delivery in this country and what we really have when we talk about the collective, right? Like, if you've got the money and you've got the resources and you've got you got the access, yeah, you're going to get some of the best care in the world.
Right. Yeah.
But if you don't, you're screwed.
So, well,
we've had this. We've had this. You're like episode like 190 something, right? Like so almost 200 episodes of people that we've been talking to, and we've said that same thing on probably almost every show. Which is, you live forever if you're rich. Like everything's fine, right? But if you're not.
Well, but that's, I mean, and you can rephrase that and package it into almost any industry. We say, the future's here. It's just not evenly distributed quite a bit too. And that's it. Your access is how big your bank account is.
And that is really sort of like a lopsided way of looking at healthcare for sure. One of my favorite examples of that is Upload, that show Upload, right? Like, if you got all the money in the world, you could live in a country
virtual
club.
reality in the afterlife.
Because it costs you $3 to experience a sneeze, right? Because you're a virtual version of yourself. And I'm like sitting there going, as dumb as funny as this show is, like, if that was possible, that's exactly what would happen. It would cost $3 for a sneeze, $5 for a fart. Like, that's how that would go. And all the poor people wouldn't be there. So,
I'm gonna have to watch it. I can't say that I'm familiar, but
oh my God, it's so fun.
It's a fun show. It got a little nonsensical towards the end, but
yeah, but like, it was a fun show, and more importantly, it's a really interesting rabbit hole of medical ethics and how does that matriculate through technological advance, right? And
a take on near future capitalism, I'll call it.
Yeah, correct. It's all packaged into one, right? Let's leave it like this: that the gurney is going down the hallway from a traumatic accident, and at the end of the hallway it says upload to one way and ER to the other way, where people just are basically like, do I want to go through the torture,
the surgery, the recovery, yeah,
or do I just want to cut it here and just go retire at this country club in Digitopia? And
Well, it's fascinating. Yeah,
It's
that is
fascinating because then if you can do that, then what else can you do? Well, you could have a cell phone in this digital world that talks to a real cell phone, because all it is two computers talking to one another, right? So then like now your loved one never really dies. They just can't be with you on the couch, but you can still watch Netflix together because, you know what I mean? Like everything's digital. So it's like it does open up quite a few thought rabbit holes that I think have been really fun to go down.
Yeah, that's fascinating. Definitely on my radar to be watching. That's for
Yeah, we
sure.
did a whole episode on it actually, so you can go
Oh,
back.
well, all
Yeah,
right.
It was like 100 episodes ago, man.
yeah, that was a while ago. Yeah, but we did a whole episode on it because it is an interesting idea. And like when you look at things like this, right? Like, why would that happen, right? If you look at it, if you ask, right? Because if you follow the bouncing ball of like burnout and fatigue and like corruption and everything else, it might just be easier to be like, fuck it, upload me. I don't want to deal with this. Like, navigating. I know a couple people, unfortunately, that have died of cancer or family members died of cancer. The medical spaghetti that you have to go through for that process should be cruel and unusual punishment. It's awful, and that is a byproduct of everything we've been talking about today. Like, I mean, it's like it wouldn't be like that if 80 other steps weren't like they were, right? Like, I don't know. The whole thing's a fucking mess. And then you get Luigi, right? And it all comes down to Luigi, right? Like,
that when that happened, obviously I don't condone violence or
well, no, obviously we have to put the asterisk. Yeah, I got it.
I do.
Yeah.
All right. Well, we'll
I
agree.
wasn't upset. Let's say it that way.
Yeah, I mean, I don't think anyone should be killing anybody, but it's not unintelligible why.
Well, I don't believe insurance companies should be killing anyone.
Right. This is also true. Yes.
Wow. No, wow. I'm debating how to choose my words for the next 2
You
seconds.
can sit down, let me shit on the medical system right now for 10 minutes, and don't worry, the Border Patrol will come to my house.
Yeah,
it's like
those legal agents.
I told people when that happened, I said, I think this is potentially going to be the wake-up call that the people in the United States have been sort of looking for in regards to what's happening.
Do you know what it was? It was a wake-up call for private security firms to make a lot more money protecting CEOs.
Well, yeah, but I do think, if nothing else, that dude's been canonized. We're talking about somebody from a really wealthy family that did something that seems very working class because he has a grievance with what the majority of Americans are experiencing. And immediately they identify with that, right? Whether you're saying killing is right or wrong, everyone, and I feel, Todd, that's what your message is doing. And I think when the physicians and the patients realize they're both kind of in this same fucked up system, that's when the power to change happens. So, you're coming in now at a time when at least we're all lighting votive candles to Luigi. And, we're saying this is really fucked up. I'm paying, $2,500 a month to not have access to my doctors. And then when I do go, I'm getting denied. I'm getting run around. I'm getting, this is not covered in your policy. I'm getting outdated information in the denials. I'm getting, oh, well, your doc didn't sign this and cross this T, and now you're sitting in limbo. And, MZ's point is they have a lot of cancer patients in that, right? Getting denied radiation and chemotherapy, which is just fucking cruel.
Oh man, if we got down the rabbit hole, then I was totally. But before we go there, I was going to talk about. I agree with you. I think one of the ways forward is going to be the power of numbers. Having the patient and the physicians, nurses, whatever their walk of life is, rowing in the same direction towards positive change or working together towards positive change. I mean, that's ultimately one of my biggest visions with this project is, in a word, solidarity, or another word, collaboration.
Right.
And is that going with certain voting arcs as MZ potentially talks about? Yeah, maybe, probably. I mean, we need to be going way upstream and see where people are getting thrown into the river, not continually pulling them out of the river downstream,
on the Uber ride home from us going to MZ, and I haven't even told Tom this story yet. The guy asked me, awesome guy, Indian immigrant, been here for like 20 years. He said, "What were you in New York for?" And I told him, I was like, "Oh, we were on this guy's show and blah, blah, blah." And he goes, and he kind of wells up a little bit. And I'm like, "Oh, I'm sorry. Didn't want to hit a nerve." He goes, "Tomorrow morning is my bankruptcy hearing because my wife has cancer and United Healthcare denied my claim, paid for my original claim, but while she was anesthetized and they've got her open on the table, they find another tumor that was not part of the original approval. The doctor literally is on speakerphone while she's out asking for an approval, which they say, no, they need to go through the proper channels. It needs to get approved, whatever." And the doctor's like, "I'm not stitching her back up only to cut her open again in 2 weeks so you could fill out some paperwork." Turns out he took it out. Now they're denying the claim. Happened, it happens apparently all the time. And now she's filing bankruptcy, which is one of MZ's big things. So I really can't wait to share this story with him. But it's like one of those things where I'm like, she didn't do anything wrong. She got the right approval. She went through the right thing. Probably that surgery was probably delayed way more than it should have been because of that stupid fucking approval in the first place. She does everything right. Lady Luck kicks her in the face one more time and says, "Nope, we've got another one." And this poor lady doesn't even know that like this is going to save her life. And now this guy says, "I've made $6 million over the course of time since I've been here." He was like he had a good paying job. Now he's an Uber driver filing medical bankruptcy, right? He's like, "I put 2 daughters through med school, ironically. And now I'm penniless because my wife got cancer." I was like, "Dude, brother, I could like cry just hearing your story. This is fucking awful."
Well, and it's not isolated. And before I forget to ask, you didn't happen to get the contact information?
I do. I do have his contact. I don't.
You want to be in a movie, man?
I took a screenshot of his thing when I sent him like a tip, like a $10 or something tip or something, $20. I don't know what it was. It was late and I was emotional, and I'm just like max tip, whatever that is. I don't know.
We'll have to talk about this offline because ironically, I will be driving through New York in a couple days to go visit a friend, but that's neither here nor there. But these stories, man, I mean, they're just everywhere.
Yeah, no, it's heartbreaking.
The financial devastation related to healthcare issues are all over the place, and who's being served by this? Certainly not the patients. And I can tell you right now, it's not the clinicians who are getting rich off these things, so it's upstream where these problems lie, and it needs to change.
But you know what, that one though, and I guess this is, I love to hear your reflection on this. That one was a specific gripe between United Healthcare and Johns Hopkins because the original approval came in apparently before Hopkins got dropped off of the schedule from United, and now United's basically like, we're not servicing anybody.
We're not anybody. Yeah.
And so,
and they tried to turn it around and blame Hopkins.
Yeah, but you know why? Because Hopkins pushed back on them being fucking assholes.
Yeah, and Hopkins had done it with Blue Cross Blue Shield about 6 months before that, and got at least and look, we can talk about giant medical systems fucking up just as much as insurance companies, but in this case, Johns Hopkins was 100% right. And look, man, it's the same thing when we see peaceful protests and they don't do anything. And then they're like, "Oh, this got violent." Well, you're not listening. You don't fucking get it, or you don't fucking care, which is more likely the case. Why? Yeah. Because a few assholes are getting really fucking rich. I'm sorry, I'm getting real pissed off after hearing that story.
No, it's a terrible story. Yeah.
It's okay to be pissed. Everyone's pissed.
Well, but I mean, this is the problem, right? And we can all go out, and we can march in the streets and be labeled Antifa, and then we're anti-American or some fucking bullshit. And we don't even realize that we're getting killed. Literally getting killed. And it's happening to the practitioners who are supposed to be taking care of us with burnout. It's happening to the patients who are getting services denied. And no one everyone's acting like it's somehow just how things go, right? I mean, that's always been my biggest. Well, yeah, you don't know what's out there, but you're so afraid to change. I mean, you mentioned it before. Was that Skinner? Was that JP Skinner with the dog shocking?
I think it was Marty Seligman. I think.
Sorry, I got my Skinner box confused with
No,
everything else.
I might be getting it wrong too. It's with an S. I should know this. Although I didn't sleep so great, so I was up at like 4:30 in the morning typing and doing emails.
You were all anxious about
like
being on our show.
Yeah, exactly. I was so nervous about talking about healthcare that I couldn't sleep. No,
well, now I'm all pissed off, and my wife's going to come home and I'm be like, I got to fix the 3D printer. And she's going to be like, why? I'm like, don't ask.
Yeah, no. Yeah. Oh man. Yeah. I mean, it's easy to get riled up, man, especially when I'm a thinking kind of guy. Like I'm trying to write a book on metacognition. I'm passionate about clear thinking. I think it's a lost art. And this kind of stuff is the sort of the apex of unclear thinking, right? So it's real easy for me to get worked up about this stuff because I'm like, God, this is you're one piece of tissue paper away from starting clearer thinking, and you just refuse to poke your whole hand through it. That's like just you could be so close, just you're not.
Well, I think the problem is here, Matt. It's intentional.
Well, yeah, exactly right. We say,
it's intentionally, like it's not. Oh yeah, there's a better way. Yeah, we're aware. Shut the fuck up.
Yeah. And I've never heard United Healthcare respond with anything really about their CEO getting gunned down by a guy who's like, you guys are a bunch of
they put a new CEO in place a couple hours later.
No, of course they did. Well, they had to. I mean, that has to happen.
The shareholders need answers.
But like that could have been, if they had a better PR agent, that could have been like a real moment, even if they lied to us, to lie to us in a better way, right? But they didn't. They were like, nope, we can't even. There's nothing.
No, yeah, you can't compete with Luigi. He's fucking gorgeous. He's a beautiful man. Yeah. He's a fucking beautiful man. I do it too. I wouldn't get the love. Yeah, they'd be like, Tom, not so attractive. No, not so happening.
He's too ugly to get away with this. Yeah.
I would get murdered in prison. Yeah. He's getting his eyebrows done.
Yeah, right. So Todd, what's up with this movie, man? When is this coming out? Like, what are we? We actually, this is a good time to talk to you about, or tell everyone that we're working with you on being a part of that.
Yeah, for sure. So I'll give you sort of kind of where we're at this point. We're in post-production editing, and we've got a 90-minute cut that we're grinding on, and it's so fun to just kind of dig into these rabbit holes and have these amazing visuals go along with these amazing voices. And I'm being a little bit nebulous, not to give the whole arc away.
Sure.
But to answer the question, we're hoping / anticipating completing the project by the end of the year, 2025. Creating a documentary is literally like, as they say, building an airplane as you're flying it.
Yep.
Like, crap, we forgot one of the wings. Let's get that wing on there, and then let's keep going. Do we think we will be able to get it onto hopefully a streaming service Q2 of 2026? I mean, I think that's the goal, and I think it is realistic. And yeah, we're thrilled to be actually met with the production crew earlier today. We're excited to be working with you guys about having a first showing in March.
We'll be the first showing?
You're saying it out loud, man, and now you're making me nervous.
Yeah.
Are we the premiere?
Yeah.
Well, at this point, yeah.
Wow. I'm honored.
Suck it, New York City.
Yeah.
Now, granted, I tend to go 1,000 miles an hour, and so I'm not going to retrace. I'm not going to retrace my steps here.
No.
I don't have a crystal ball, but at this point, March 18th looks like it'll be the first full viewing of this documentary, Suck It Up, Buttercup.
Well, if we don't end up being the first, I won't hold it against you. I'm psyched to be the first.
Yeah, we're
just
awesome, happy to be part of it.
Really
man.
Fucking psyched that we even got into this conversation with you at all, because it's so on brand for us, such a passion thing for us, that I'm like, this is awesome.
Yeah,
I think so too. I mean, when Tom and I first talked about this and he brought it up, I was like, this seems like an amazing idea. Well, and Tom, one of the things that happens when you start having these conversations is more doors just keep opening. Like I mentioned, and it's fresh on my brain, so there's some recency bias associated with this. I just interviewed Terry Mulligan, as I said. He's a professor at University of Maryland.
Yeah.
Funny
And
how
so-
that all lines up, huh?
Yeah.
And he lives in Baltimore, and I'm like, Terry, we need to talk a little bit more about this.
Yeah,
you know,
and
as
see
we
now
go
you call
forward.
him up and he goes, "Oh, I could have like my whole department down
Yeah,
there." You know what I
how
mean? Like,
many
now
how
all
many
of a sudden-
people do you need? And even when you brought Mary Beth into the phone call, she's like, "I went to JHU." It's like, yeah,
Yep.
look, see,
Yeah,
we got it. And even with the theater selection, we don't want to say too much until things are written in stone, but she had some ideas about that too, and it was like, no, you're absolutely right, and Matt can walk to that one.
and I could walk to that one. Yeah, So, yeah, Todd, I'm super excited. If that one sticks, I'm real psyched. I can just literally saunter down to your.
I think it's awesome, you know, and
Yeah.
I think it's just the beginning with hopefully with this product and what we're trying to accomplish. I mean, you know, you don't write a book, you know, you don't do a documentary to become rich, right?
Okay. Speaking about the book, Todd, just mention the book, and I'll hold it up, even though everyone's watching this on Spotify.
Yeah.
The book is called Ripple of Change, and I'll digress for half a second. It's co-authored by myself as the physician, and then one of my former patients, Joshua Judy. And so we weave our two stories together: my journey through burnout and the freaking mess that it is, and how it affects just a boatload of people in those concentric circles, and then his journey of the mess I created for him with a prescription medication.
Oh wow.
And actually, what's really interesting about that, Matt, is the script that really screwed him up was my savior for the better part of 8 years from post-concussive headaches. It was the exact same drug.
Wow.
He had a devastating response, and to me, it gave me my first headache-free day in over a year at one point.
I mean, Tom and I joked about renaming the show N of One because we say it enough. But like literally there's thousands of examples that just keep coming across my desk every single week.
And you get those you want those giant ass numbers. So when you're making a public health statement, you're helping the most people. Yeah. And even if it's 95% safe and effective, 5% of people are gonna fucking have a bad time.
Yeah, for sure. And Joshua absolutely did, you know, just back to that story arc a little bit. But as I was saying, you know, you don't write books and do documentaries because the goal is to get rich, right? I mean, those are passion projects. Those are projects out of love and caring for other human beings. And I'll try not to cry. But, you know, I talked about my going through burnout, but a big driver for me that I'm just relentless on trying to pursue positive change is also related to the frustration of patients. You know, when I was seeing patients full time, it was daily people complaining about the healthcare delivery system, to the point where I would have to tell people, like, look, we've got to work on your blood pressure a little bit here. Like, we spent 20 minutes bitching about this insurance company and this thing and that thing. Like, how about we talk about your blood pressure and getting it to a range where you're not going to have a stroke? But another big motivator for me is, you know, I've lost 4 of my colleagues to suicide in my career.
Oh man, that's rough.
And 2 of them were close. You know, one was a good friend from medical school. You know, after residency, he died by suicide. And then another one was my partner. And I couldn't even talk about it for a while without crying because I felt guilty.
Man.
Sure.
You know, I was like, what did I miss? I never asked him how he was doing. Like, I was right next to him for years, and then he's gone.
Right.
You know, and it also speaks to sort of the effed up way how we were trained. You know, be self-reliant, be autonomous, and just work harder, and just do more, and all these other things that are great until they're not.
Right.
And then when they're not, people get so desperate that that's their only way out. Like, so yeah, I'm very driven on these projects for, you know, emotional reasons and to honor the memory of those that, you know, came before us or were with us, what have you.
Yeah, one of our very first early on guests, Mandy Wardner, I remember she said something. She's like, you know, sometimes life is just this balloon you keep breathing into, right? But eventually there's could be just a little tiny breath that just pops the balloon, and that's what no one's prepared for, is because you don't really think every other breath before that, the balloon just got bigger. You're like, oh, that's fine. There's more room in there. We can keep going. And then all of a sudden it could be nonsensically small. It doesn't even have to be a big thing, but it just, you know, snaps. That's it, you know?
Yep.
And I think I do think that now, time for a different podcast, but we have so many other things outside of medical that are also bearing down on everybody relentlessly. That the balloon isn't just influenced by your breath, it's now influenced by a bunch of people's breath, right? And so now you're like, oh my God, I can control this, but I can't control any of that. And certainly none of this, maybe a little bit of that, but it just seems like a never ending game of trying to stabilize.
The number one thing people are saying coming to my clinic now, and this is I'm not making life or death decisions, but the number one thing they say is, given everything, when I go, how are you doing? Given everything. And they don't just mean their condition, right? They take that second to look at what society looks like, the shit they're going through, the shit they see other people going through, the government shutdown, all of it. And hey, I guess I'm okay, but you can tell no one's okay.
Kind of okay.
No one's okay. On a scale from 1 to 10, and 10 is, you just lost your job from a government shutdown and you're worried about your family and, hey, my back hurts. I don't even know how you quantify any of that anymore.
Yeah, I think you're right. I mean, I think people are overloaded with information. We're overloaded with substance abuse. We're overloaded with gun violence and opiate issues and all this other stuff. And it's overwhelming at times to many, many people when you really step back and go, what are we doing? What are we valuing here?
Yeah, and again, it all traces back to unclear thinking. We just had a show about kratom advocacy, and in some states, it's put into a class 1 schedule 1 narcotic because it's too overwhelming to think logically about it. So they just say, "Fuck it, let's just throw it in with cocaine."
Yeah, we're not gonna regulate the harmful synthetic derivatives of the plant.
Right.
And we're not going to look at the research, so get rid of all of it.
And in the meantime, I could be giving somebody a non-opioid for their pain instead of just pumping them through of oxy. And you know what I mean? Again, this is all unclear thinking, and it's because no one's taking...
you hear it with Charlotte's Web. You hear it with everything, right? You can't give that to a kid.
Yeah.
Look, the kid has had seizures since they were born, man.
Yeah.
So I there's so many ways to slice this, and there's so many problems, Todd, and I'm just so fucking happy that our paths crossed, and at least, if nothing else, we can amplify your message a little bit.
Yeah. No, I thought I
appreciate that. And I was going to say, we got about 20 minutes. We probably could knock at least a half a dozen of these problems out.
I mean,
yeah.
I mean, I'm sure we can
come up with a couple of things. Yeah, for sure. You know what? I sometimes say to myself, why couldn't it be that easy? If you look at small scale, small businesses do this all the time, right? They have a problem in the morning and by the afternoon they have a solution. Now, granted, the scale is much different, but the spirit isn't have to be different. We just get locked up in the next rule is the rate blocker, right? Okay, well, what if that rule didn't exist, or what if it was changed a little bit? Why are we using other dumb rules to get in the way of solving this dumb rule, right? The rule should be, if I'm trying to solve a dumb problem, any barrier that's also equally or less stupid should just be ignored until we get to a clear path.
My favorite quote from from Rick and Morty is, "No, you're right. Let's do this the dumbest way possible to make it easy for you."
Yeah.
And I feel like that's how we approach problems. Rather than taking the shortcut, and or we'll just do whatever and not think about the outcome, right? Oh, we changed it, and it's yeah, but you weren't thinking 3 steps ahead. You weren't thinking about why you're changing it. You weren't thinking about the problem you were trying to solve. You just changed it to change it. Or you're not going to do shit because that seems complicated.
Yeah.
And it all just, it upsets me. It's one of the most infuriating things about the human condition.
Well, I'm going to put it maybe just in touch with some of the nonprofit work that I'm involved with.
Yeah.
I don't know if either of you are familiar with the group Medicine Forward.
No.
I'll give you a little bit of backstory because it's totally morphed to where it's at today. Medicine Forward started as an alternative way for physicians to organize under a handful of amazing leaders, including Eric Topol. Kind of think like maybe the AMA in an alternate universe, perhaps it was kind of the idea behind it, if you will. Over time, I think many of the physicians realized like organizing physicians is like herding cats. At times, they're all going in different directions, as you can imagine. And so currently, I mean, the organization's opened up to pretty much any positive change agent that wants to join. And one of the cool parts of it is we've been experimenting with what are called catalyst groups, which is a decentralized way of organizing and facilitating things and really trying things and experimenting and not getting bogged down in all this bureaucracy. And, it's early on. We've been doing this for less than a year, but there's been some amazing yield as a result of this. So the mission statement is catalyzing positive change so the patient-physician relationship can flourish. And clearly we are aware that the ecosystem that supports that dyad goes way beyond just the physician and the patient. Every clinician under the sun, nurses, caregivers, family members, they're all involved in this. And by allowing people to explore and do things, there's been some really cool programs that have come out of it. Lots of conversations are happening with medical students or medical interest groups as a result of this. So we're getting not to say, hey, great, Todd's getting to talk to somebody, but other individuals like me talking to the next generation about, hey, let's not repeat some of these problems. That's been an amazing thing. Dr. Chris Beringer is a family physician. He created a program called the Rising Star Program, where individuals can, if they want to be on a podcast track and learn how to do podcasts or write articles or facilitate meetings and all these kinds of things, they're just happening. And people are like, well, what does the Medicine Forward do? And it's kind of like, well, it's kind of hard to describe because we're doing all kinds of stuff, but we're not like stamping our label on it saying, oh, we're the catalyst. We're making reactions go, and it's fun to be a part of that. And the documentary is one of those things. So Mary Ann Wilbur and I are both on the board of Medicine Forward and in the executive committee. And to be in a fun group that's willing to take a little bit of calculated risk and explore and push back at times. I don't know. I guess that was sort of a bit of rambling, but I get excited.
No. It's awesome to hear that. I think that's cool. I mean, I'm encouraged that these things are popping up.
And there's lots of them too. I mean, I think of other groups too. The Patient Revolution is another group that's doing some amazing work to challenge the status quo. Sheila Maroney is the executive director, and Victor Montori wrote a book called Why We Revolt. I'm actually meeting with Michael Fine tomorrow. I don't know if you know Michael. He's another family physician who's got an organization called Primary Care for All Americans. There's all these orgs popping up out there. And so the opportunity, and obviously I'm healthcare centric, right? I mean, that's kind of my jam,
Sure.
and where I'm at. So that's what I talk about a lot. But there's all these opportunities for people to join. And I often talk about like time, talent, and treasure. Like, you don't need to make a documentary to make a difference. You don't need to write a book. You don't need to have a podcast. Maybe that's not your skill set. Maybe you don't have the time for that, right? I'm pretty sure most people can skip that latte in the morning and donate $5 to a good cause. Pick one. I don't give a shit which one you pick. Pick one that you think's trying to do something good for the world and support them. That's a way to contribute to moving the needle. And so
I just gave $10 to Wikipedia yesterday.
What's that?
I said I just gave $10 to Wikipedia yesterday.
There you go. So all kinds of fun things that are kind of going on. Yeah, lots of ways to participate. This is my ultimate message.
Yeah. Awesome. Well, Todd, great, listen, man, I'm excited because thank you for spending some time with us today. But I'm actually excited that this is definitely not the end of our story with you. I'm really excited for March. That's going to be fucking awesome, man. I mean, and we funny enough, we floated it out with some previous guests, and I think we've actually got some interesting things kind of brewing around it.
Yeah, like putting together a bigger thing. Yeah, man.
Putting together some thing where that just brings attention to your thing, and it's going to be awesome. So like we're very, very excited there. But in the meantime, let's talk the commercial here. Let's get to you. Where do we find you? Where do we send people? Like give us everything.
Oh, sure. Yeah. So a couple links I'll give. In terms of social media, I'm the most active on LinkedIn. That's how Tom and I connected initially. It was via LinkedIn, and I think it was a post on MZ. And so if you message me on LinkedIn, there's a good chance I'll get back to you within a reasonable amount of time. In terms of websites, the website for the documentary is suckitupbuttercupfilm.com. Got to have the film in there, suckitupbuttercupfilm.com.
The other one's a porn site. No, I'm kidding.
Without looking, that's probably the best guess.
I just guess because I think my default guess on the internet is it's porn.
It's rule 34, I believe it is.
That's probably not a half bad guess most of the time. In terms of, if you're interested in learning more about Ripple of Change, that's rippleofchange.us. And then the nonprofit I talked about is medicineforward.org. Got it.
Awesome.
That's fantastic, man. I like I said, I really love what you're doing. I think it's awesome that you're making a movie. I think it's awesome that we connected with you and we get to help out in some small way. So I'm very excited for all of it. So,
well, you know what, things happen for a reason, like you cross paths and when you lean into those relationships and go with yes and. Like Tom's like, well, this is a good idea. I'm like, well, let's do it. Yes, and
let's do that.
Let's figure it out.
Let's do that. How do we start there?
Where are we going? I don't know, but let's go fast.
Yeah, Richard Solomon. We spent a day with him a couple years back, right before COVID, and that was the one thing that I took away from that conversation was he's like, TED Talk started because of yes and. Like, what else? Like, yes, of course, that is true. Now, what else is also true? And I'm like, that's a really cool way of looking at it because a lot of people kind of stop at the here's the thing.
Here's where it ends. Yeah,
totally.
All right. Well, listen, guys, have a great weekend. Todd, looking forward to seeing you again.
Yeah, man. We'll talk
in a couple
soon.
months, and we'll talk soon.
Thanks for having me, guys. Much appreciated.
Right. Awesome. Take care.
Be subversive, irreverent.
Health is wealth, but you knew that.
Everybody knows that.
But so is following us on social media at Irreverent Health. And check out our website for more exclusive content at irreverenthealth.com.
Oh, I like this.
Thanks for tuning into this episode of Irreverent Health.